Good morning, everyone. Thank you all for being here today. I do want to thank a few people. The Chicago Department of Family and Support Services Commissioner, Brandy Kanazi, thank you. Our Deputy Mayor of Immigrant, Migrant, and Refugee Rights, Beatrice Ponce de Leon, our Chief Homelessness Officer, Cindy Soto, the Office of Emergency Management, our Director, Jose Tararo. Thank you all, the OMC, DFSS, CPD, Chicago Public Schools, City Colleges, CTA, CDPH, DCASE, DOH, BACP, Aviation, and all of those acronyms. You can see Justin Lawrence. He studies this stuff every day. Trust me, he does. Aviation, 2FM, Parks, Streets and Sanitations, Libraries, and of course our team in the Mayor's office. I would also like to acknowledge and thank our Vice Mayor, Walter Burnett, Jr., and our Housing Chair, Alderman Byron Sigcho Lopez, for their unwavering support throughout this entire mission. As many of you all know, the 27th Ward hosted the most shelters. The 25th Ward hosted the largest shelter. Finally, we could not have done this without our partners in the faith community, who opened their churches and arms to our vulnerable residents, as well as to our newly arrivals, and their tireless effort to our mutual aid groups from day one. Our community of small businesses who have stepped up in the time of need to feed those in need. I look forward to the continued collaboration with them and the city council members as we enter into this next phase. Additionally, I would like to acknowledge the partnerships with the state of Illinois, the Department of Human Services, Governor Pritzker and his entire team. They've been remarkable. Cook County partners, including the board president, Tony Preckwinkle, the Cook County Health Department, and the Board of Commissioners. Thank you all. All of our alders who stood with us, supporting, finding solutions in City Council. Really thank you from the bottom of my heart. We look forward to the collaborating with the One System Initiative partners, including the state of Illinois and many community providers who participated in drafting a vision and recommendations for a more equitable, effective shelter system. When my administration came into office, we inherited a humanitarian crisis with scores of buses with newly arrivals sent from the southern border without notice, care, or any coordination. This act was meant to destabilize Chicago as a welcoming sanctuary city. We fought back and showed the world just how welcoming we can be. My administration, in collaboration with partners in the state and county governments, along with hundreds of mutual aid volunteers and community partners, were able to create the infrastructure and means to support the almost 50,000 men, women, and children who arrived in Chicago over the course of the last 2 years. Even with the threat of more buses being sent to Chicago ahead of the Democratic National Convention, we stood strong and built an infrastructure to sustain the demand for shelter. Due to the executive order signed by President Joe Biden and the hard work, we are now moving into a different phase of this humanitarian effort. Currently, we are seeing fewer and fewer asylum seekers arrive in the city of Chicago. And the resettlement efforts, wraparound services, and support provided in the shelter system by Chicago and our partners at the county and state empower thousands of new arrivals to be on a path to self-sufficiency. So we are now able to shift from a large-scale crisis response to a more cost-effective, equitable, and strategic approach that addresses homelessness for all who need support. And that is why today we announce steps to demobilize the new arrivals operation by the end of 2024 and transition to the One System Initiative 2025. This shift means demobilizing the new arrivals mission by the end of the year to focus on adding 3,800 beds to the legacy DFSS homelessness service system in collaboration with state partners and advocates. A one shelter initiative is a single, unified system that consolidates the new arrival shelters with the current Chicago delegate homelessness shelters. This will help to ensure that we have a single and equitable shelter system for anyone. An equitable shelter system for anyone experiencing homelessness. It will also eliminate shelter stay limits and over time will provide more options for unhoused residents and families with children. We will continue to work with our One System partners to further develop resources and services to better meet the needs of anyone who needs service, whether they arrived here just a few days ago or have lived here all of their lives. Look, we've already shown the world that we have the determination and the fight to meet the needs of almost 50,000 new arrivals in less than 2 years. 1 year ago today, thousands were sleeping on the floors of police stations, airports, as we stood up new shelters every single week. At the peak, there were 12 to 15 buses arriving daily and 15,000 beds in operation. We collaborated with the county to ensure basic health care, joined forces with the state and community-based organizations to provide wraparound services and rental assistance. We supported resettlement and reunification of thousands of families and individuals. Our city also activated the philanthropic, faith, and human services communities to develop small-scale sheltering, rapid responses, and new resources to help meet the urgent needs. Mutual aid volunteers across the city leveraged their networks, built from COVID response, showed up in unimaginable ways to welcome our new neighbors. CPS enrolled an estimated 20,000 new arrivals. Under the leadership of CDPH, we overcame a measles outbreak that had no playbook for congregate shelters. And while we have had many successes, this mission has highlighted Chicago's growing housing crisis and our need for long-term investments in shelters, wraparound services, and safe and affordable housing that support people on their pathway to self-sufficiency and success. Housing is a human right, and that principle always guides my policy and my practices. And that is why I champion Bring Chicago Home, invested $250 million this year for homelessness services, and passed an historic $1.25 billion investment for housing and economic development in chronically neglected parts of the city. Our housing agenda creates pathways for sheltering unhoused neighbors in permanent supportive housing, all the way to home ownership, which will help close the racial wealth gap. In fact, speaking of bringing Chicago home, we have projected the need for as many as 11,000 shelter beds to serve all Chicagoans experiencing homelessness, including our new arrivals, 11,000. This number is a worst-case scenario if no policies or programs were activated to provide support. Our cost analysis determined that the $100 million estimate that would have been raised through a dedicated revenue source like Bring Chicago Home would have helped close the gap and fund the 11,000 beds. Say that one more time. The number of beds that we actually need to respond to this crisis, if we would have passed Bring Chicago Home, less than 3% of the wealthiest of those who are wealthy, the money that we would have raised would have responded in a timely fashion to the crisis that is in front of us. Instead, we can only cover what our budget allows. We are making a significant investment, more than doubling our 3,000 shelter bed capacity for a total of 6,800 beds. But imagine the increase in our capacity if Bring Chicago Home would have passed. Look, I'm excited to continue to do the important work towards a one unified homeless shelter and services system to better serve everyone who is in need. It's a part of our policies to build a better, stronger, and much safer Chicago. The next phase of this transition includes coordination, collaboration, and leadership as our Chief Homelessness Officer, Cindy Soto, launches the development of a 5-year strategic plan to integrate the One System initiative and other efforts of our city and community partners to support our unhoused neighbors. I'm proud that we have a commitment to remain a welcoming city that provides for everyone I'm proud that the work in the community continues to grow to meet this great challenge. Our potential is still yet unmatched. And thank you all to all of you who have done hard work. And with that, I'd like to introduce our Deputy Mayor of Immigrant, Migrant, and Refugee Rights, Beatrice Ponce de Leon.
Good morning.
Good morning.
Thank you all for being here, and thank you, Mayor, for those remarks. Thanks especially for your leadership over the past 17 months as we, the City of Chicago, faced the new patterns of migration happening across the world and impacting us directly here in our city. Together with many partners, we worked diligently to navigate the city's response, balancing our responsibility as stewards of public resources, our values as a progressive administration, and our commitment to serve all Chicagoans. It wasn't always easy. We learned many lessons along the way, but in the end, Chicago developed a compassionate, fiscally responsible resettlement model that prevented nearly 50,000 people from becoming unsheltered, and that set our city on a path toward a better system for all. To put into perspective the scale of the operation, I want to share a few more highlights referenced by the mayor, and I'll start with CDPH. We have built an infrastructure for immunizations and public health screenings that has now immunized or administered well over 50,000 vaccines, 30,000 alone for measles. We've also served approximately 25,000 individuals in partnership with the state and their rental assistance program, connecting them to apartments and moving to other places with friends and family. The city, in partnership again with USCIS at the federal level and the state and community organizations, helped 8,500 people apply for temporary protective status or work authorization. And through an innovative program for volunteers, we have now listed over 900 volunteer opportunities that people have been able to plug into, with organizations supporting new arrivals as well as most recently in our shelter system. We launched an ESL and a financial literacy program to bring to our new arrivals. And Chicagoans have been generous, donating over $500,000 to our Amazon wish list by purchasing products there. More than 1 million baby wipes have come our way in donations, and really tens of thousands of coats and winter gear were gathered last year. People have donated in many ways their own individual time and treasure, and the organizations that support our human service infrastructure here in Chicago. At the beginning of 2024, at the height of the mission, as the mayor mentioned, we were serving 15,000 people in our shelters. These were individuals from around the world. Yes, there were Venezuelans there, but we also have Haitians, Ecuadorians, Senegalese, Colombians, and many others in the shelter system. And while the arrival of immigrants and refugees in Chicago is not new, we are a city that has seen groups of immigrants throughout our history. The sudden arrival of asylum seekers in a very short time frame was unprecedented. And our city was tasked with handling this crisis response without a budget and with minimal federal support. In the end, we did it. We didn't do it alone, but we were able to manage this operation and now transition into a bigger, better system for other people experiencing homelessness. Ultimately, the New Arrivals mission was driven by two goals. One was to meet the most basic human needs of people arriving here, and the other was to learn and leverage the moment to build better systems of care. After taking office, our administration quickly recognized the importance of sharing this responsibility for the migrant mission with all levels of government. And I recall very directly working strategically to bring on the partnerships that we needed with the state and the county, which resulted in new investments and in a more inclusive regional approach. We also understood that the two systems were inequitable and that we had to work towards one, and made the commitment for the One System initiative. And finally, we knew that resettlement of asylum seekers and refugees is a federal responsibility. We had to call on our federal government, advocate for more support and for policy changes that would make a difference. We will continue to advocate with the federal government for resettlement cities like Chicago, and also for comprehensive immigration reform that includes work permits so that people who are here are able to support themselves, their families, and contribute to our communities. And finally, migration and seeking asylum are internationally recognized human rights. Having a safe place to sleep and to call home is also a human right. I'm proud to be part of an administration that is committed to upholding these human rights and uplifting our most vulnerable individuals and communities. This has meant helping asylum seekers on their journey, but also investing in housing and homelessness and investing in the Black community in Chicago, which has faced generations of disinvestment and marginalization. Our mayor has said this often, it's not either or, it's both and we have figured out ways to do that. As we move away from the crisis mission into our accelerating this transition to the one system into next year, we know that it is the right time. The city has not received a bus in the area since mid-June, and arrivals at the landing zone are much lower. We are also seeing that of the folks who are arriving here, only about a third are having crossed immediately at the border and having been in the country for a lower number of days. This period between today and the end of December will be a transitional phase in which we ramp down the operations. And in a moment, you'll hear from Harley Jones, our executive on loan, about the details of that work. Beginning in January, as we move into the one system, our Chief Homelessness Officer and Commissioner Brandy Kanazi will work to roll that out in partnership with the state. They will provide more details in a moment as well. I want to echo the mayor's appreciation for all of the people of Chicago who worked day in and day out to make this mission a reality and to make sure that our operation was a smooth operation throughout. I'm grateful especially for the mayor's office team that has supported our work as we developed new systems, new policies, and new protocols to make this happen. And, without listing all of the organizations, I think it is important to call again and say thank you to the many, many Chicagoans, volunteers, organizers, advocates, donors, mutual aid groups, community-based organizations, faith groups, philanthropy and foundations, and others who've come together on their own and with us to make this happen. As we move forward on this path, the transition might be a bit bumpy at times, but I know and I'm certain that in the coming months, our systems of care for anyone experiencing homelessness will be expanded and improved. Our team at the Office of Immigrant, Migrant, and Refugee Rights will continue to support these efforts, but we will shift our focus to policies and programs that promote immigrant integration and inclusion, such as language access and workforce development for all immigrants, ensuring that our newest neighbors, as well as those who've been here for longer, have opportunities to thrive. And this is good, both for them and for our city. And as these efforts take off, we will strive to apply an intersectional lens and to build solidarity across communities, because we know that by uplifting our most vulnerable, we will be uplifting all. With that, thank you so much for being here, and I look forward to our continued work together. Thank you. Harley, I'll pass it over to you for more details.
Good morning, everyone. Thank you so much. My name is Harley Jones. I'm an executive on loan in the mayor's office supporting the new arrivals mission. First, I want to thank the mayor and his entire team and every city department for just letting me be a small part of this historic work. And today I'm here to spend a few minutes talking about the policy changes that we're going to use to support the overall demobilization of the mission and how we help in moving towards the one system in 2025. First, I want to highlight the fact that everyone is working hard to support the new arrivals in the city shelters. It's also my job to make sure that everyone understands that we will not have the same level of resources available as we move towards the end of the mission. First, I'm going to talk about the landing zone. We will be limiting access to new arrivals to the new arrival shelter system only to those individuals who have been in the country for 30 days or less, if and when beds are available. Placements will continue to be for 60 days, but those 60 days won't be guaranteed because of this transition. All new arrivals will continue to have access to out-migration and support services when they arrive. To further support these changes, we will be ramping down the operations of the landing zone as we move towards the end of the year. Beginning November 1st, the landing zone will begin operating 8 a.m. to 8 p.m., which will mirror the office hours of the state-run intake center. We want everyone to know that starting November 1st, we will have limited resources for new arrivals coming from other cities. This means there will be no overnight landing zone staffing, and after that, buses will not be used as waiting stations. Our public messaging will continue to focus on those updated hours, access to a resource guide for new arrivals, and guidance to the DFSS and 311 system. Like the overall mission, the landing zone will be closed by the end of the year. We will also be changing new arrival shelter policy to support the overall decompression of the shelter system as we move towards the one system in 2025. Inside new arrival shelters, we will be removing the extension category for individuals who have been waiting on decisions for public benefits. Extensions for medical, disability, pregnancy, and other special circumstances will remain in place. We want to ensure that the most vulnerable individuals in our care have the supports that they need. New arrival shelter policies will no longer be applicable in January 2025 because the legacy system policies will be applied across all shelters. This means that there will be no more 60-day shelter stay policy or extensions because those policies are not in the legacy system. In this transitional period between today and the end of 2024, we will remain focused on supports for new arrivals, both at the landing zone and in the shelters to help expedite their path to self-sufficiency. New arrivals will continue to have access to targeted case management aimed at supporting resettlement and self-sufficiency, out-migration and connection to their sponsors here or outside of the city, access to the resources of the state's intake center and community-based organizations in Chicago, a robust resource guide that will inform them about the services available to them both at the city and across community-based organizations. We will also make sure that they have detailed instructions on how to access the city's 311 system. Thank you so much for letting me share that with you. I now want to turn it over to Commissioner Kanazi from DFSS. Thank you.
Good morning, everyone.
Good morning.
First, I want to thank the mayor for his vision and his leadership to get us to this point. There was a time when we didn't see an end to this, and so this is a very historic date. I'm grateful to be able to stand before you today and speak to the progress of the city of Chicago is making in addressing homelessness. We take an evidence-based, three-pronged approach to supporting the unhoused. That includes prevention, crisis response, and housing. We have worked tirelessly with our partners to address systemic barriers to housing so that people don't experience homelessness in the first place. DFS funds the Homeless Prevention Call Center, available by calling 311, which is a hub for homeless resources and funding. We also fund a rental assistance program available through our 6 community service centers that have helped over 2,990 households remain housed since the COVID-19 pandemic. We operate our own homeless outreach and prevention team, and we also work with and fund experienced homeless outreach shelter providers, street outreach providers, and drop-in centers to meet the needs and make sure that those experiencing crisis, that we work to get them housed and into stable housing, since we know that housing is the answer to homelessness. COVID relief funding allowed us to take innovative programming such as rapid rehousing to new levels of effectiveness. Between October 2020 and August 2024, 2,970 households were successfully moved into housing through this program. 72% of households have remained housed when services ended. That's really important to know the retention rate. We are also investing in improving the physical infrastructure of our shelter system to better serve safely and with dignity the people that need shelter resources. In partnership with Commissioner Castaneda and the Department of Housing, the city will improve 700 to 1,000 shelter beds in our system over the next several years, with improved accessibility, privacy, and trauma-informed design. The first of these projects, a newly purchased and renovated shelter for 70 beds for men experiencing homelessness, is set to open in December 2024 in Rogers Park. I want to be sure to give a shout out to First Deputy Commissioner Maura McCauley. She led this effort along with Deputy Commissioner Andrea Chapman, Directors Kim Howard and Christine Riley. These ladies have worked long hours to personally ensure the success of these programs, and I want to thank them for their leadership in being on our team. When new arrivals began coming to Chicago in August 2022, our team was able to meet the moment and build an entirely new system to ensure that new arrivals were able to receive services and get connected to what they needed in a crisis environment, while all the while maintaining capacity of our crisis response system to meet the existing needs. Through coordinated efforts with other city departments, state and federal government partners, and local community-based organizations, thousands of new arrivals have been screened for a variety of affirmative immigration remedies and supported with applications for asylum, temporary protected status, work permits, and more. Our partners have brought into our shelters an array of services for our newest neighbors, including mental and medical health services, cultural orientations, know your rights trainings, gender-based violence trainings, arts and cultural programming, housing and resettlement supports, and coordinated enrollments for CPS and our early learning program providers. I cannot overstate the importance of how Deputy Commissioner Danny Castaneda and his team, BJ Lohr, Natalia Santillan, Alejandra Magana, and many, many others on our team at DFSS and OEMC and so many more city departments have gone above and beyond to make sure that families had a place to stay, they had food to eat, and ensured that they received trauma-informed care after their long journey to our great city. It is thanks to joint efforts that the numbers of new arrivals seeking shelter in our system today has decreased from nearly 15,000 in January to just under 5,000 today. But this is not DFSS's or our city's achievement. This is the people of Chicago showing our compassion and welcoming character. Each passing day, we witness more new arrivals establishing themselves in our communities. They are learning our traditions, resilience, diversity, and the overall history of our great city, Chicago. And we are doing the same, learning about their values, enjoying their food, vibrant music, and unique saison. After all, the things that unite us are greater than the things that divide us. Our institutions need to emulate our people when we need a crisis response system that serves all Chicagoans, regardless of how long they have been in Chicago. The city has been participating in the One System initiative since March of this year, along with our partners at the state, county, service providers, and people with lived experience of homelessness. We're here to talk about the next stage of this transformation of Chicago's homeless services system by sharing what the city is able to support at this time. First, we will be moving towards one streamlined way to access shelter. As the landing zone phases out, everyone will begin to access shelter by calling 311. Second, we will sustain 2,100 city-funded shelter beds plus 1,700 state shelter beds currently for new arrivals and fold them into our homeless service system. These shelters will be operated by community-based organizations in alignment with the rest of our entire homeless system. With existing city and state commitments, this is a total of 6,800 shelter beds for anyone in need of shelter. Third, we will expand capacity building and technical assistance to serve everyone equitably and effectively in our system. Homeless shelters in Chicago have long served anyone in need who shows up their door. Serving households who are new to the U.S. is not new to our homeless system providers. But with this transition, we will have more support for all of our shelters in sharing and implementing best practices, an opportunity for enhanced data standards, ensuring language access, and supporting better outcomes for shelter residents. This transition will not happen overnight. We will be planned and intentional as we work with service providers and the Chicago Continuum of Care. This transition will allow us to build a stronger, more resilient crisis response system. Our staff and partners will continue to strive to ensure that families that arrive in Chicago are reunified with their friends and family and re-leverage diversion services. For some, Chicago is not their destination, but a stop along their journey. We will continue to provide services with compassion, dignity, and respect. We remain committed to eradicating homelessness in Chicago. Next, I would like to bring up our Chief Homeless Officer, Cindy Soto. Thank you.
Good morning, everyone.
Good morning.
I want to take a moment to express my heartfelt gratitude to our dedicated government team and our community of philanthropic partners and our CBOs. Without them, we were not able to meet this mission the way we have now, and it is a moment to celebrate. Their unwavering dedication and collaborative spirit have been truly inspiring, and it is this collective effort that profoundly impacts the lives of the people that we serve. As we transition from the new arrival system to our legacy system, I am excited about the opportunity ahead to continue bringing the mayor's vision to life of creating a stronger, more equitable homeless service system for our great city. This change is not just about operations. It represents a chance to enhance our strategies and ensure that every person who is unhoused or at risk of losing housing receives the compassionate support they need. On September 16, we received important recommendations regarding the One System initiative from community partners. This work will guide us with the state of Illinois to build a unified system. These recommendations will shape our future direction, and we are committed to integrating them into our plans. Two initial key initiatives we are pursuing include instituting a rental assistance program to help decompress our shelters, and establishing an access point that incorporates the promising practices we've learned from the landing zone. Our unified objective is to improve our services and programs, ensuring that everyone can access the necessary resources regardless of their circumstances. Community engagement will be crucial as we implement these significant changes, and we will be sharing more details on how the city plans to launch the 5-year strategic plan. Your voices, insights, and experiences will be essential in shaping our path forward. In the meantime, I encourage you to continue reaching out to us. Together, we can ensure that our efforts truly reflect the needs of our community. Thank you for your dedication, compassion, and tireless efforts to everyone. Now I will turn it over to the mayor for questions and answers. Thank you.
Thank you, everyone. Again, I want to thank Alders Walter Burnett Jr. and Byron Sigcho Lopez for their leadership. We also have Alders Ramirez and Hall are here as well. So thank you both for being here. I see Dr. Ige is here as well. And with that, I'll take questions.
We're going to do on-topic questions, one question, one follow-up, so flag me down if you have an on-topic question. Alice?
Good morning.
Good morning.
So just to clarify, come January, when the system is unified, what is the shelter exit policy, if any?
It will be the policy that encompasses the current legacy system. Go ahead, Brandy.
Good morning. There will not be a shelter exit policy. So in the legacy system, there is not an exit date. So people will be allowed to stay in the system.
Okay, and of the 3,000 legacy beds that DFSS has, how many are currently occupied? And if they are close to capacity now, how do you ensure that by the end of the year there isn't another, scramble for more beds?
So there's a couple things that we're doing, right? We know that on any given night that our regular shelter system is about 98% full. Part of the work that we'll be doing with Chief Soto and the One System initiative is folding all of these beds in. And so as individuals in the new arrival system, we're going to continue to work with the state on rental assistance, right? And make sure that we are moving people along in their shelter journey. We also have a commitment to make sure that we're using the rapid rehousing model. So you heard me talk about the numbers. That has been a way that we've been able to move people in shelter, out of shelter, and into housing. So we're creating that path through. The last point is really about leveraging the system and making sure that we have a coordinated response about how we prioritize individuals going into shelter into 2025.
I think the last point is, again, had we been able to pass Bring Chicago Home, this conversation would be much different. The interests of corporations got in the way of what was a clear opportunity to generate revenue from less than 3% of the overall Chicago population, of which 97% would have received the tax break. Unfortunately, those scare tactics have put us in this position now where we are doing everything that we can afford.
How will it work logistically? Are you going to be housing migrant families with homeless families or homeless men? How will it work logistically? Is everyone going to be in shelters together?
The goal of the one shelter system is that there's not, it's to eliminate a segregated system. Anyone who is experiencing this crisis of not having someone to lay their head, will have an opportunity, with some limitations, of course, to have access to at least some shelter. Now, as far as how we delineate over time, as we've already articulated, as we continue to decompress between now and the end of the year, the individuals that are in place or in shelter now will be logistically either remain where they are or move to the locations that we have established.
And just a follow-up, and what is the status of the favorite staffing contract, and what happens to that under this new system?
Thank you for that. It's a good question.
Good morning again. So, as you know, we have moved from a contractor model that supported our shelters to, we have started to transition to a CBO model. We currently have 2 community-based organizations, Bright Star and Clio, that are running shelters. We will continue to continue that pattern of practice, and all of the shelters for the new arrivals, current shelters, will be operated by CBOs, just like our homeless system. Currently, right now, we have about 557 favorite staff, and so as we close out this mission, we will close out the favorite contract as well.
And again, the last point to that last point, I want to thank Bright Star and Clio, Pastor Harris and Pastor Barrett. Both of these individuals, we grew up together and essentially in the same church, same denomination. These are Black-led organizations responding to this mission. We've already saved the taxpayers over $200 million just through our shrewd ability to renegotiate agreements multiple times. And I do apologize, Commissioner Kanazi, who had to help lead that charge, but we needed to save taxpayer dollars. And so it was cumbersome, it was an arduous process, but again, it saved $200 million, and we're able to put community-based organizations, particularly ones that are led by Black folks, to respond to this mission, especially because we know that 70% of people who are unhoused right now in Chicago are Black folks. So, this again is a celebratory moment, but yet it's still very sobering because we need to do more, and we will continue to work hard to do more.
Can you talk about what the out-migration services look like, exactly what you do for people who basically you can't accommodate and need to go elsewhere? And also, what sort of impact will this have on your budget next year?
Well, we'll start with that process. Deputy Mayor?
Yes. Thank you for the question about out-migration. The state of Illinois has a program that they fund with community partners to connect people with friends or family somewhere else. So they verify if people don't want to stay in Chicago, they're actually trying to get somewhere else in the Midwest or another part of the country, and they will pay for a bus ticket for them to do that, to out-migrate. There's also some support for folks who have a shorter way to go, maybe a suburb, they have somewhere else, someone to meet other than Chicago, and they're not staying in the shelter system. They get that ride, Uber ride or ticket or taxi ride covered for them. Thank you.
And then I think as far as the budget is concerned, look, this mission that we inherited, when the governor of Texas decided he wanted to attack Chicago, we rose above it. We still need more federal support, you all. This is a global crisis, by the way. I was in New York, Tamana, a couple of weeks ago with a Clinton Global Initiative. Name a city on the planet, and they're all dealing with the same dynamic. Global population shift, and national governments and federal governments have not done enough. And we know what the motto should look like. It's the motto that we used when, the tyrant in Russia attacked the Ukrainian people. And when those refugees needed a safe place to go, our federal government attached resources to those individuals, and there were communities that embraced them. And that's the point that our deputy mayor is saying, that we're talking about thousands of families that have made it to the United States of America. There are pockets or enclaves of communities that are stronger now, and they are prepared to embrace them. There are some other Midwestern cities, I can just say that are also interested in being supportive. What we have appropriated in this budget is what we can do right now. And, I've made a commitment that we were going to invest in people, and that's exactly what we're doing, and we're investing in everyone.
And to the budget specific question, then how much are you going to ask City Council to approve for this unified
Well,
system?
you know, Taman, if you want me to give you my budget address before I give the budget address, man, as much as I like you, brother, I can't do that. But there will be an ask. But the ask is to respond to this one shelter system. That is the ask. We're asking City Council, the City of Chicago, to embrace an historic moment. This has never happened before. We took a crisis, managed it, and turned it into an operation of care and equity. That's what I said I was going to do. And so I'm grateful that we have alders here that recognize that assignment. And again, we cannot allow the federal government to abdicate its responsibility by responding to a crisis that they technically have the sole responsibility to respond to. Thank you.
So would it be correct to say, or that the $150 million that in the budget forecast for new arrivals would be shifted to this new approach of
No,
one?
that's not correct to say. So that $150 million was for this year's budget. This year's budget is expiring. What we're saying is I'm going to present a budget to the City Council that's balanced with investment in a one shelter system. Right? This is about what I said that I would do, was create a one shelter initiative that will allow us to respond to homelessness, period. Whether you have just arrived or whether you've been here for some time and you're down on your luck. I think the part about it that's most frustrating, and I thank you for that question, is that if we would have passed Bring Chicago Home, if the interests of corporations who have demonstrated that they are stingy and greedy, that had they just allowed for less than 3% to pay a small incremental increase on the transferring of property, which 97% of people would have received the tax break, we would have a system right now with 4,200 more beds. 4,200 beds. And that work has to continue. We have to continue to organize and show our work. See, as a public school teacher, I would always ask my students to show their work. I'm showing my work. We're building a single shelter system that allows us to respond to homelessness. That's what we are going to appropriate for, and I'm counting on the City Council to vote yes on that.
So the 3,000 additional beds, 3,000 and some change, is that going to be?
Is it 2,100?
It's 3,800.
38.
2,100 cities,
1,700 states. So 2,100 city. I thank you for that clarification. I just want to make sure the people of Chicago know the difference. So it's 2,100, the city of Chicago, 1,700 state.
So are those beds going to be in existing shelters that are going to stay open, or?
That's a good question. So right now, our team is still working through where those final locations will be. Yep. Thank you.
Hi, Mayor.
Hi.
There are nearly 5,000 asylum seekers in shelter today, which is a majority of the 600, 800 beds we'll have under this new unified system. Can you just explain more logistically how the city will determine who gets a bed under the new system? For example,
Harley,
will it be,
he talked about that. Harley, you want to talk about that?
I guess, will it be like first come, first serve for those currently in the system?
Harley, you got it.
Will they have to leave and re-enter? Will they be guaranteed a bed under this new system? Can you just delineate how they'll work for current residents?
Yeah, great question. And in particular, this is going to be focused on some of the policy changes that we mentioned. So one of the ones that we highlighted was that removal of the extension around kind of the administrative decision around public benefits. So what we found is that we have almost 1,800 folks within that shelter system who have received somewhere between 1 and 7 extensions to their shelter time, who've been waiting for this administrative decisions on public benefits. And so one of the things that we're doing in changing that policy is making sure that we're having those conversations with caseworkers to get them to start thinking about that self-sufficiency and movement through the system as opposed to waiting for that administrative decision. At the same time, we continue to focus, as Commissioner Kanazi mentioned, on supporting out-migration and self-sufficiency as we move them through those systems. So the caseworkers will continue to have those conversations as we decompress those shelters. And as we mentioned, the LZ will continue to ramp down as we move forward, which means the number of beds and the number of resources will continue to go down as we move through the demobilization of the system. And then as we move into 2025, the way that people get shelter as it relates to the homeless system in Chicago will be unified and brought together.
So starting January 1st, will everyone currently in shelter have to leave shelter and reapply then, regardless whether they're asylum seeker or in the current shelter system?
Yeah.
No, so after January, once people, if anyone who is currently in shelter has a 60-day notice, that will go forward to the end of the year. Starting in January, people will then go look for shelter by calling 311, and it will be on a first available basis.
I guess one quick follow-up on the 311. Will this come with any more resources for the 311 system, considering it's been under strain already? Will there be more funding at all specifically to help with 311?
That's a great question. That's all a part of our budget considerations. You'll hear that once I give my address.
Good morning.
Good morning.
It would seem as if
You look so sincere this morning, too.
I try. It would seem as if there are two very different populations here, the homeless population and the migrant population. How do you integrate the two into a single shelter system, knowing that there'll be some reliance on mental health, I imagine, for the homeless component of that? And then
Well, look, I will say, respectfully, homelessness is homelessness. I get where you're going, and I do appreciate just that dynamic that you're naming. It's more or less how they became homeless, right? And so the how they became homeless is no longer the determination on whether or not you'll be able to access services. We're just simply saying, if you're homeless, we want to be there for you. That's it. Now, in terms of the type of services that homeless people will need, that will vary. And that, from behavioral and mental health support services to work authorization, right? So if you are a born resident of Chicago, work authorization is not something that's required. You just need a job. If you're not born in Chicago or America and you're unhoused and you come here as an asylum seeker, of course, the work authorization component will be critical. That's the remarkable part. I'll close with this. The remarkable part about what we're doing. We have taken a global dynamic, a crisis that is pervasive across the planet, and we have operationalized it as a city government. I just want for a moment there, whether you all appreciate that or not, I just want the people of Chicago to know how appreciative I am of their dopeness. There's nowhere else on the planet that has been able to stand the test of time in this crisis. You all know what the coverage was a year ago, because you all covered it. And to see where we are today tells you everything you need to know about this administration. We don't cower under pressure. We rise above those attacks. And so if you are homeless by way of seeking asylum or because you've experienced gross disinvestment from previous administrations, my administration is going to show up for you. And I made a commitment to invest in people, and that's exactly what this effort does.
One follow-up. If Bring Chicago Home would have raised $100 million.
Conservatively, right? Conservatively.
How much do we save by going to this unified system?
Well, as I expressed earlier, we've already saved $200 million just based upon us negotiating better agreements with community-based organizations. And so you're right to ask that question about cost savings, and that's essentially what we've done through the repeated efforts of every single department to renegotiate agreements that I inherited to save the taxpayers $200 million. I will say this, had Bring Chicago Home passed, I can tell you the amount of money we would save in what it costs to protect a life, what it costs to educate someone. For every dime that we invest in the front end, we save dollars on the back end of a child. I appreciate the sophistication and the sincerity of your question, because that is exactly what we purpose to do, to take a crisis, manage it, build an operation that doesn't burden everyday people.
Morning, Mayor.
Good morning.
I have a lot of logistical questions, but I'll try and pare them down.
Can you get it into one, though? That's the key.
Well, one and a follow-up, absolutely.
Okay, all right, 1.5.
All right. Talking to the new arrivals out on the street, there are still a recurring cycle of them that are re-entering the shelter system. They're going back to the landing zone. If 2,700 have left, 2,000 have re-entered that system. So there is still a demand. And when we talk to them individually, they say, I'm still struggling. I still need work authorization permits. There's a lot of uncertainty in their minds. knowing that going forward, that we're sort of ending this mission, do you have concern that many of these people will end up homeless?
They already are homeless.
But I
They're
meant
just-
out on the street,
I
outside
got
the
you.
shelter.
Hold on a second, but just keep this in mind. They are already homeless, just like the 20,000 children in our Chicago public schools are homeless. Look, I didn't wake up May 15th and get sworn in as mayor and started to worry about homelessness. When you're a public school teacher in Chicago, I can tell you, we come face to face with negligence in this city all the time. Our police department does, our fire department does, our city workers. So we're very concerned about the conditions that we inherited, and now what you're seeing is a real legitimate concerted effort to actually address the crisis. Should they be concerned about work authorization? Yes. Does the mayor of Chicago have the ability to authorize work? No. So that's why I'm fighting our federal government, and particularly the Republican Party that's being led by a freaking lunatic who told them not to support substantive, comprehensive immigration reform because he wants to prove a political point. And he has worked to pit poor brown people against poor black people. Shame on him. You talk about a joker. It's Donald Trump. So yes, as you can hear in my voice so eloquently, of course we're concerned about work authorization. And yes, we're concerned about the unhoused, but that did not happen with this mission. We've been struggling with this dynamic, and this is why we're creating with our partners, state level, county level, to respond to it.
And the follow-up is more of the timing question of, are we announcing this today because the city is in such a financial hole that in order to go forward and sort of, I guess, lessen that blow, you've got to announce this and hopefully inherit some cost savings?
We're announcing it today because it's the right thing to do. It's the right thing to do. Now we'll get to the financial ramifications to it, but I just want the people of Chicago to know that we stand up for our values. You know, what the Republican Party and the extreme right in this country meant for evil, we've turned it around and made it of something good. That's who we are as Chicagoans. Look, trust me, I've heard it from some of my own relatives, like, Mayor, we love you, and, you know, how long are we gonna be able to do this? And we've stood the test of time. You know, the $1.25 billion investment for housing to create more entrepreneurs, the largest investment in the history of Chicago for the West and South Sides. Building more and more affordable homes. Between Constaneta and Boatwright, you talking about two people working overtime for this city. These two commissioners are planning, developing, building every day because it's worth it. Now, as far as the other part of your question about the financial straits that we have, that's not a secret. How long have you been covering City Hall? How long have the finances been jacked up? You know what I'm saying? We're fixing it. You know, administration after administration ran this, spent all the money, and then begin to sell its public assets, right? That's like me inheriting a home, use up all the equity in the home, and then begin to sell the valuable items on the inside. I'll make it more plain. Parking meters, the Skyway, sold off all the assets, didn't pay into retirement pensions, didn't invest in these neighborhoods. The financial challenges that we're having right now, I assure you, did not happen under my watch, but they will be repaired under my watch.
Excuse me.
Take your time, Judge. You okay? Get him some water.
I'm fine.
Are you nervous?
Yeah, this is the time.
I'm gonna
nervous,
listen.
right?
Let's just have a toast to Justin Lawrence. I'm gonna drink some water for him.
Second time you said my name. You know, correct me if I'm wrong. It seems like we're going from 8,000 beds now down to, what was the number, 6,800, right? So we're losing 1,200 beds. You have, you know, as he mentioned, 2,027 of the 2,747 people who've left shelter have re-entered shelter. There just seems to be a disconnect here that you can wind down this system, lose 1,200 beds by the end of the year, and that it won't directly lead to more people on the streets.
Well, we've been decompressing. Look, we didn't just get down to 5,000 without a logistical plan, right? So as we've decompressed, we have narrowed our approach. Look, that's not what we ultimately wanted to do. That's why we were fighting for progressive revenue. And trust me, I've been fighting for that for some time. And so I hear what you're saying. I understand why you are concluding that it's a disconnect, but be very clear, this team has been working on decompressing for months now. And so based upon the work of Beatrice Ponce de Leon, our deputy mayor, as well as our executive on loan, Harley, they've come up with a plan based upon the individuals that are currently in stay, who have historically received extensions of stay, that those individuals who won't qualify no longer allows us to continue to decompress. Now, to the last part of what you're ultimately concluding, and to what some of your other colleagues have raised, could this lead to people on the street? Look, I'll be remiss if I did not acknowledge the financial straits that we are experiencing right now and the impact that that's going to have on this mission. But I can tell you, it's not just our financial challenges in this particular mission. I can tell you that if we don't find the right revenue for our public education system, I can tell you the people who are going to lose there too. Same thing with community safety. All I'm saying is you are talking about our budget in a silo. The city government is responsible for, what do you all pass, like $16.8 billion? We're talking about multiple sister agencies that we have to coordinate with, multiple city departments that we have to coordinate with. I don't want to see anyone lose, right? But the harsh reality is that we can do what we can afford. We've been stretched to the limits. This is why I'm working with our partners at the state to help us. But ultimately, the care has to come from the federal government, you all. I cannot emphasize that enough. I know you all are asking me what my responsibilities are. And I've demonstrated to you, even the things that I'm not responsible for, I'll still do it. It's like a typical middle child, isn't it? And there are limitations. I've said from the very beginning, it's not sustainable. And that's why this election is so important.
And back to the budget. So specifically in your budget forecast that was released a month ago or so, it had a specific $150 million line item, same as last year.
Yeah, that's not the case anymore. I'll give you the full budget address in a couple of weeks.
The $982 million included $150 million from.
As I said, you'll get the full budget address. Look, I get the question. I'm saying that I will give you in my budget address what the actual ask will be for this mission.
So is it fair to presume that that line item will be taken away and a portion of that will be used to fund this kind of beefed up permanent shelter system?
Okay, it's safe to say that we are going to work with City Council to pass a budget that reflects our values, and particularly our values around fighting the unhoused crisis in Chicago.
Hi, you've already touched on this a bit, but a couple weeks ago when the recommendations came out, those recommendations were to maintain 14,000 beds. So obviously this is less than half of that recommendation. What would you say to those critics who are going to see that and see that as not a commitment from the city? And is there any commitment to maybe increase the beds in 2026 or
we passed
down
Bring
the line?
Chicago Home. Look, I mean, I get where the criticism is coming from. I do. The criticism is coming from decades of disinvestment and not having operations that actually respond to this moment. And so this is why our 5-year strategic plan with our chief homelessness officer is so critical. Cindy?
Thank you for the question. There were a lot of recommendations that we are taking under consideration, and certainly the expansion of all of the beds that we need to serve all in-house populations will be part of the 5-year strategic plan, as well as what the budget would mean for the city of Chicago and others that pour into this work. So federal government, county, our other partners across the government sector. And so I want to make sure that folks don't think that we're not going to consider the rest of the recommendations. At the moment, the immediate recommendations that we're going to be looking at are the rental assistance and also the access point. And the rest of the recommendations we're going to continue to talk to the state about, and then also engage all of the constituents in the city of Chicago.
I had a quick follow-up on the access point. The recommendation was for that to be open 24/7 every single day a year. Is that going to be what the access point is, and is there going to be bilingual staff there?
Yes, to culturally and linguistically appropriate services. That is something that the city has committed to from day one. In terms of the hours of operation, we are talking to the state in relation to what that's going to cost us and who can service the access point 24 hours. So that is to be determined, but it is something that we are discussing very directly with the state of Illinois and other partners as well. Thank you.
Thank you for those questions. Yes.
Buenos días, Mayor.
Buenos
Jorge de
días.
Santiago with Telemundo. The question will go in Spanish if that's okay for you, for
Sure.
Beatriz
Somebody
Ponce de
can help-
Leon.
Someone here can help me with the language.
Absolutely. And this goes to Beatriz Ponce de León. ¿Qué es lo que deberían de saber las personas que van a llegar por acá? El mensaje es claro que a partir de 2025 todo va a estar bajo un solo sistema. Can you just put that into perspective, que nos lo digas todos en una frase completa de qué es lo que va a ocurrir, la importancia si es que hay preocupación?
Yes. The question is what message we want to send so that people understand what will happen beginning in January of 2025. And you're asking for the migrants who might be coming to Chicago. Yes. Bueno, quiero compartir que vamos a cambiar el sistema de albergue para personas que han cruzado por la frontera sur, que vienen a Chicago. A partir de hoy hasta el fin de diciembre se van a implementar cambios en la política de los albergues y también en el sitio donde la gente llega a pedir el refugio. En este momento, ahora el límite va a ser para personas que tienen apenas de 30 días o menos en el país. Quiere decir que si usted cruzó la frontera hace un año, ya no califica como persona que nosotros consideramos una persona recién llegada pidiendo albergue. El segundo cambio va a ser que las personas que en este momento residen en los refugios que tienen extensiones porque están esperando los beneficios públicos del estado de Illinois, ya no se les va a seguir dando esa extensión. Hay personas que tienen ya 4, 5, hasta 7 extensiones porque están esperando esa decisión. Pero sabemos que podemos apoyarlos con alguna asistencia del estado, de la ciudad, de bastantes organizaciones para que busquen ellos la manera de resolver y buscar otro sitio, otro lugar en donde vivir. ¿Está bien?
And my follow-up question in Espanol, if that's okay, Mayor. One more follow-up question.
For Beatriz or me?
For Beatriz, just to.
okay,
Is that okay? I'm giving you a little break, sir. A little break here.
Listen, that's why
Awesome.
I'm good. And me and Justin can use some more water here.
Beatriz, ¿esto era lo más efectivo en estos momentos para, por ejemplo, para vecindarios como Byron Sixto López, donde veíamos que estaban todos en una bodega, estaban en un centro? ¿Esto era lo más efectivo? ¿Esta era la ruta que necesitaban tomar en estos momentos porque ya ven la disminución? ¿O creen que todavía van a encontrar algunos problemas en el camino?
Bueno, el momento es apropiado porque desde que comenzó esta misión nos dimos cuenta que no podíamos sostener dos sistemas de refugios separados. La ciudad tiene un sistema de tradición de largo plazo de ya 3,000 camas. Ahora con lo que estamos viendo en la reducción de necesidad en el sistema de refugios para migrantes, vamos a hacer una combinación de camas. Van a quedar 2,100 camas de la ciudad y 1,700 del estado, que son para migrantes. Esas se van a combinar con el sistema de la ciudad completo. A través de los meses que siguen, se van a ver la manera de coordinar y combinar esos refugios, pero en este momento es necesario empezar ya a cerrar la misión para poder hacer esa transición a un sistema más grande y más fuerte y sostenible para todos los que necesiten refugio en la ciudad. Gracias.
Thank you. Good. All right. Well, thank you all again. I just want to express again the incredible amount of joy and appreciation and a degree of humility in this moment where this monumentous task was met by everyday Chicagoans. And I can't emphasize enough the support that we receive from every single department and sister agency. Again, special shout out to Beatriz Ponce de Leon, Harley and Cindy, but our commissioners, Kanazi and Dr. Ige. Let me just say this, you all, the world has come to Chicago to figure out how we've done it. And this is not hyperbole. There was no playbook for the CDC on how to respond to an outbreak in a congregate setting in a shelter. A black woman, Dr. Ige, set the standard for the rest of the country. People around the country begin to find out that we passed a bus ordinance that challenged the governor of Texas to work with us. Now, one bus has come to Chicago, you all, since last December, because there was never an interest in coordinating with us. Their job was to try to create chaos, to influence the outcome of an election. Shame on them, but thank God for the people of Chicago. God bless you.